As a pharmacist, one of the most common things that I see are ladies in their 40s, 50s, and 60s with chronic UTIs, which end up on antibiotic after antibiotic after antibiotic. There's a lot of things that have to go right for you to take a probiotic by mouth, go to your stomach, through the gastrointestinal tract, and get to the vagina. If your microbiome is not healthy, it's going to increase your risk of UTIs, sexually transmitted diseases, and other complications even during pregnancy. So if you're struggling with chronic UTIs or BV infections or yeast infections, you've got adequate hormones, your microbiome may be the one thing that you're missing. Welcome to The Trusted Pharmacist, where you'll learn the truth about how the body works. Welcome back to The Trusted Pharmacist. I'm your host, Steve Hoffart. We talk about microbiomes all the time, and your gut microbiome is so important. But if you're a woman, this podcast is for you because there's another microbiome that you have that may be almost as important, and that's your vaginal microbiome. That's the natural collection of bacteria that live in the vaginal area that are your true mechanism to not only protect the vagina, but also protect your sexual organs and keep your reproductive health healthy, and also help you prevent urinary tract infections. So if you struggle with any of these issues, or vaginal health is something you struggled with in the past, we're going to talk about the importance of keeping a good, healthy vaginal microbiome and setting you up for success in your future. The crazy thing about the vaginal microbiome is when it's healthy, you don't even notice it. But when it's not healthy, you definitely notice it. It can have itching and burning. It can affect your ability to get pregnant. It can cause infertility issues. It can cause problems with sex. It can cause problems in terms of chronic UTIs. And it also can increase your risk of infection. So once again, when it's healthy, no problem. But when it's out of balance, it sets you up for a whole host of health problems. And we need to address those and understand why keeping a healthy microbiome, especially in the vagina, is so important. So before we take a deep dive, you might ask, Steve, why are you a pharmacist? And secondly, not a medical doctor, and especially not a woman. Why are you even having this conversation? How do you know about this? I'm going to tell you 3 important reasons why I think I'm a really good expert in understanding the importance of a good vaginal microbiome. First, in my wellness training, I've heard some of the top hormone experts in the world talking about vaginal health and the importance of hormones when it comes to vaginal health, because these hormones directly play a role with your vaginal microbiome. So I've heard a lot about the importance of how hormones can control a good, healthy microbiome. Second, I've got to work with one of the top gyno-uro infectious disease experts in the country at the Houston Medical Center. And he has taught me so much about vaginal health and the vaginal microbiome, and how if we just keep the vaginal microbiome healthy as it's supposed to be, so many other problems get resolved and it doesn't cause issues. So his knowledge and expertise has been phenomenal. And then finally, I'm a pharmacist, so I'm all about drugs and supplements, and I've learned a lot about probiotics and the importance of probiotics. But when it comes to the vaginal microbiome, specific species are so important, and we're going to go into that. But what I've learned is, as a compounding pharmacist, we've worked with patients to produce specific products that can help balance and set the vaginal microbiome in its optimal health. And what's amazing is I've had so many ladies that have come and given us reviews or personally told me, Steve, you have so radically changed my overall vaginal health, and it's directly affected my overall health. Because unfortunately, when the vaginal microbiome is out of balance, it sets up for a whole host of other issues. And today, you're going to get all the answers that I've learned over the years to help reset that vaginal microbiome, make it healthy, cut down further healthcare risk, and most importantly, prevent UTIs so this doesn't become a chronic issue. So now that I've established that I've helped thousands of women help reset and produce a good, healthy microbiome in their vaginal area, I hope you understand why I feel like I'm an expert to help you be successful on your journey. So first of all, keep in mind, the vaginal microbiome is a host to millions and billions of bacteria. And most importantly, the species that's dominant in the vaginal microbiome is the lactobacillus species. Those are things like Lactobacillus rhamnosus, Lactobacillus gasseri, Lactobacillus crispatus, and Lactobacillus jensensi. And unlike the gut microbiome, where we want a good diversity, we want hundreds and hundreds of different types of bacteria. When it comes to vaginal health and the vaginal microbiome, actually a limited number of species is better, because if we get too diversified in the vaginal microbiome, it sets up a problem. So we want a nice, good community collection of Lactobacillus species, because if we can keep this good collection in the vaginal microbiome, this sets you up for overall better vaginal health. So you might say, these are just bacteria. How do they actually maintain good vaginal health? Well, let's go into that. One of the core functions that your vaginal microbiome produces as a female is it keeps the vaginal pH in a nice tight balance. We want that vaginal pH 3.5 to 4.5. And if it gets above 4.5, it actually sets up an environment for unfriendly or unwanted bacteria and yeast to grow there. So your vaginal microbiome is key to keep that pH properly balanced. And without that good pH, it sets you up for a whole host of other issues. And other than keeping the pH low, believe it or not, your microbiome, these bacteria in the vagina have the ability to almost have their own defense mechanism. Because keep in mind, your vaginal microbiome is what protects your sexual organs. That's your uterus, that's your ovaries from the outside world. And this is where you have children. This is where you create babies. And we have to protect those highly sensitive, highly specific organs away from the outside world. So your vaginal microbiome can actually produce things like lactic acid, hydrogen peroxide, and bactericidins. And these actually can ward off bad bacteria, viruses, yeast, and sexually transmitted diseases. A third unique role for the vaginal microbiome is it competes with adhesion sites. For anything that's unwanted, ideally like bacteria and yeast to stay in the vagina, they have to be able to stick to the vaginal walls. And believe it or not, the good bacteria there, these lactobacillus species, compete for these binding areas. And if the good bacteria line the vaginal walls, the bad bacteria can't stick and set up and cause infections. And finally, a good vaginal microbiome boosts natural immunity of the mucosal secretions of the vagina. And finally, they lower inflammation. So all of these things together set up a good, healthy vaginal microbiome in terms of the vaginal walls, the secretions, the pH, and its ability to fight off bad infections. And if we keep a good, healthy vaginal microbiome, we've got protection. But if it breaks down, it sets up for other problems. So one of the keys to keeping a good, healthy vaginal microbiome is having adequate estrogen. Estrogen is like the fertilizer for the lactobacillus species in the vagina. And if estrogen levels are erratic or begin to fall, and that's super critical in terms of perimenopause and menopause or other parts of life, i.e. a hysterectomy, then your vaginal microbiome is going to suffer. And we have to be conscientious of this because unfortunately we can put the good bacteria back, but if we don't fertilize them and set up a good environment with estrogen, we're going to struggle with keeping those bacteria there and healthy. So estrogen is critical here because it fuels glycogen in the vaginal walls. And then your lactobacillus species then ferment this glycogen to produce lactic acid. And this is so critical in terms of keeping the pH low and fighting off bad bacteria. But what's important to remember is during perimenopause, menopause, or even taking certain birth control pills, our natural estrogen levels drop. And when this happens, that lactobacillus is missing those key species that it needs in terms of the glycogen and then the lactic acid to keep the vagina healthy. So low estrogen leads to less lactobacillus species, which then leads to a higher pH. And this sets for certain type of bacterial infections to set in, urinary tract infections to set in, and then you can even have an increased risk of yeast infection. So now I hope you understand during menopause, it's so critical to keep adequate vaginal estrogen because now you understand it has a dramatic impact on the vaginal microbiome, but then it also has an effect on the mucus secretions. It also can cause dryness, thinning of the mucosal layers, which just further sets you up for infections, increased risk of vaginal issues in terms of urinary tract infections, painful intercourse, pain, and all of these things just because the estrogen is low. But a lot of it all starts out because low estrogen causes a dysfunction in terms of the vaginal microbiome, which sets you up for a lot of issues. So if your estrogen levels are low, that vaginal tissue, because it is so sensitive to low estrogen levels, because there's a tremendous amount of estrogen receptors there, is typically the first tissue that will begin to scream when your overall body estrogen levels drop. So things you can do is replace natural estradiol. You can do estriol, which are two of the main estrogens your body makes. But other options are also to do something like DHEA. And there's a lot of good data even out now where many ladies who thought in the past because of cancer issues or risk issues couldn't do vaginal estrogen. Many of the gyno-uro societies have now begun to say, many studies show by using vaginal estrogen, there's not an increased risk of other health consequences. And thus vaginal estrogen is now a safe alternative. Because keep in mind, if you can replace that vaginal estrogen, you begin to rebuild that glycogen lactic acid cycle, which supports your lactobacillus, which allows for your vaginal health to go up, improve your resilience, and cut out this recurrent issues that happens with UTIs, vaginal dryness as you get older, especially when you go through menopause. And as a pharmacist, one of the most common things that I see are ladies in their 40s, 50s, and 60s with chronic UTIs, which end up on antibiotic after antibiotic after antibiotic. And we know the havoc that wreaks on the gut. There's some studies out that say if you take one course of an antibiotic, it destroys or messes up your gut microbiome for 1 year. But that same antibiotic you're taking for your UTI also matches up the vaginal microbiome. So we've got to break this cycle. So let's go into a little bit more how your vaginal microbiome can prevent UTIs. So most importantly is the lactobacillus actually block the E. coli from being able to bind and stay in that vaginal urethral entry point. Because unfortunately, if you don't have good bacteria in the vagina, what happens is that E. coli then has a place it can hang out protected and can stay safe. But if you have a good vaginal microbiome of good lactobacillus species, that E. coli doesn't have a home to hang out with. It can't hang out in the vagina and then set you up for further UTIs. And there are lots of studies that show that if you're low in their lactobacillus species, your incidence of UTIs goes up. One particular lactobacillus species, Lactobacillus crispatus, is one that's been shown in studies. If women have adequate amounts of this vaginally, their UTI rate will actually go down. But keep in mind, it isn't just UTIs. There's plenty of studies that show ladies in terms of sexually transmitted disease and HPV actually have decreased risk of these infections if their vaginal microbiome stays healthy. And to make this more interesting, your body's pretty smart. During pregnancy, your body uses the vaginal microbiome to produce adequate amounts of lactic acid. And this excess lactic acid now helps to stabilize that mucus plug, which can actually prevent ascending infections and preterm birth just by your microbiome being healthy. So that's why having a good, healthy microbiome going into pregnancy is so important. So when it comes to promoting a good vaginal healthy microbiome, I want to talk about a couple supplements that I think are helpful in terms of also working with the good healthy vaginal microbiome to prevent UTIs. And then one additional supplement that you might consider that actually can help promote a good healthy vaginal microbiome when you're doing everything you can and a good bacteria just doesn't hang around. So in terms of prevention of UTIs, one of my favorite things to pair with a good, healthy, good vaginal probiotic is something called D-mannose. D-mannose has actually been shown to prevent E. coli from being able to stick to and hold onto the bladder wall. And if the E. coli can't sit up to that bladder wall and hang on there, they get flushed out every time you go to the bathroom and they can't set up for infection. So D-mannose is a good option to pair with a probiotic to help prevent UTIs. But something that I found a little more powerful than D-mannose is something called proanthocyanidins. Big, long word, don't freak out. You've heard about drinking cranberry, right? Well, something that naturally occurs in cranberry are these called PACs or PACs, which is this proanthocyanidins. But unfortunately, you would have to drink massive amounts of cranberry juice to really get enough of these to be effective. And these, like D-mannose, prevent the adhesion of E. coli into the urinary tract. But I'll tell you from my experience, I have found these to be more effective than D-mannose by itself. But what is key is finding a product that is a super concentrated form of these proanthocyanidins, like 36 milligrams a day. This is shown to be extremely effective when combined with a probiotic to prevent recurrent UTIs. So just want to stress my two favorite things to pair with a good probiotic for the vaginal use is something like D-mannose or proanthocyanidins, which is in a product that I like to recommend called Jenna MD, because it works very well to help knock out the two big things. It prevents the bacteria from hanging on the vaginal walls, but then it also helps to not set up a good environment for the E. coli to live and hang out. In a minute, we're about to talk about how you can actually raise the amount of good bacteria in the vaginal area. But unfortunately, some of these techniques don't work. So one last supplement that we're finding that can be helpful to raise good levels of bacteria in the vaginal area is a supplement called lactoferrin. Lactoferrin can actually be very beneficial in terms of maintaining and raising lactobacillus species in the vaginal area when nothing else will seem to work. This is more of an additive to the microbiome or to the probiotic that you're doing. Lactoferrin can break down the biofilms. Unfortunately, if you have a bunch of bacteria that hang out in the vaginal area for a while, they can create like a force field around themselves to protect themselves from the other good bacteria, and this is called a biofilm. And this is one of the ways that lactoferrin has been shown to help reduce some of these biofilm formation and allow your good bacteria to set up shop and get rid of the bad bacteria. In addition, it calms inflammation and it actually protects the mucosa of the vaginal area. And this combination of helping promote the good bacteria in the vagina area to be more healthy, to be more effective, and fight off the bad guys, lactobacillus combined with lactoferrin can be a good choice to help promote a good, healthy vaginal microbiome. So now that you know the importance of having a good, healthy vaginal microbiome, but how do you actually get those good bacteria there and stay there? So let's talk about that. So for many years, it's been taught we'll take an oral probiotic that's got the good strains. You take that by mouth, it colonizes the gastrointestinal tract, and then somehow, some way, you're going to get transference to the vaginal opening, and that's how you're going to get a good, healthy vaginal microbiome. And yes, that kind of works that way, but there's a lot of things that have to go right for you to take a probiotic by mouth, go to your stomach, through the gastrointestinal tract, and get to the vagina. So one of the things that I've learned through the years is that it's much easier to get good, healthy bacteria to the vaginal area by actually using a vaginal probiotic. And what we mean by that is you actually can take the probiotic that's formulated in a capsule to be taken by mouth, and you can actually insert it vaginally. But what I've seen for this is this can work. You don't have to do this for a very long time. So our regimen typically is find a good, healthy vaginal probiotic product that you're happy with, that's got all the strains that we've talked about that can provide healthy benefit to the vaginal area. And I'll go over that with you in a second of what I look for in a good vaginal probiotic. But our typical regimen is to insert one capsule vaginally for 30 days to help set up a good, healthy microbiome, but then also take and do one capsule by mouth orally for 90 days. And that's kind of a basic regimen to reset not only your gut healthy microbiome, but also set the vaginal microbiome. Now, you may say, Steve, like, am I really going to insert a capsule vaginally? And here are some tips and tricks that I've learned to help make that a little easier. So first and foremost, what I found is if you'll run the capsule under some water before you insert it, that'll make it easier. Sometimes ladies are using estrogen vaginal cream. Sometimes coating that capsule with some of the estrogen vaginal cream before you insert it can also make it easier. That's not always the best way to do it. There are some compounded options that we possibly can deliver things like lactic acid and some of the probiotics vaginally. So you might consider that too. Those are a little user-friendly to use. But as of right now, we found one of the best ways to raise your vaginal microbiome and get those good numbers of lactobacillus up is actually to insert one of the good vaginal probiotics vaginally for at least 30 days. And we've seen great success with helping get those bacteria levels up quickly and then maintaining themselves over the long term. So keep in mind, if you've been on round after round of antibiotics, or you just finished an antibiotic, or you're trying to break that cycle of chronic UTIs, that is the regimen that I would follow. Like I said, you can take a probiotic orally and hope it gets to the vaginal area, but I can tell you inserting a capsule vaginally tends to be much more effective to raise those levels. And especially if you've recently been on an antibiotic, this is a great way to get a high level of those good bacteria in the vaginal area quickly. So now you know the importance of a good vaginal microbiome and how important it is. So how do you pick a good probiotic? So let's break that down. If I was looking for a product, I would look for one that initially has at least 20 billion or so CFUs. These are colony-forming units so that you get a good number of bacteria that it can either colonize the vaginal area or get in the gastrointestinal tract and do their work. So start with that. And then you want to look for some key strains that are in this probiotic. And three of the most important ones in terms of vaginal defense are Lactobacillus crispatus, Lactobacillus ginsensii, and Lactobacillus gasseri. These are so important in maintaining a good pH and a good healthy vaginal mucosal lining and mucus production. So if you're going to pick any type of vaginal probiotic, it has to have at least those three strains. And two strains that have a lot of data that show that the oral use can actually prevent UTIs and BV issues. Those are things like Lactobacillus rhamnosus and Lactobacillus reuteri. Once again, taken by mouth, there's data to show that these are helpful, but they also can be inserted vaginally to give you additional benefit in terms of preventing UTIs and having recurrent issues. Stop and break that cycle. And then finally, because this probiotic is going to be taken by mouth also, we want to look for good, healthy bacteria strains that keep a good, healthy gut vagina access in terms of keeping your gut and the vagina healthy. So we also want to look for certain bifidobacterium strains that can be beneficial. These are things like Bifidobacterium lactis, Bifidobacterium brevi, and Bifidobacterium longum. These have all been shown to produce a good, healthy oral and gut microbiome, so they also could be helpful to the vagina. So if you're looking for a product, we're looking for this synergistic mechanism of all of these bacteria together to help set the gut up for health, but more importantly, set the vagina up for good, healthy microbiome so that you can break these recurrent issues and some of the problems that can occur when your microbiome gets out of balance vaginally. So now you've set up a good, healthy vaginal microbiome. You're doing all the things right. But what are some of the lifestyle things that I see, that I hear all the time, that can disrupt a good vaginal microbiome? And the first one of those are things like douching. Unfortunately, that, along with harsh cleansers, even things like smoking, can actually kill off the good lactobacilli species that live in the vaginal area. So we want to minimize the amount of douching or those type chemical cleansers or chemicals that we're applying vaginally, because anything that we do that wipes out the natural microbiome, changes pH, introduces chemicals that kill off our bacteria, can be harmful to the lactobacillus. And once again, if we don't have a good amount of lactobacillus, the pH begins to change and it sets us up for a whole health of other bad vaginal consequences. Your vaginal microbiome needs a good, healthy mucosal lining of the vaginal tissue. And this mucosal lining of the vaginal tissue is what sets up for a healthy vagina. And what's important is certain vitamins and nutrients, things like vitamin D, vitamin A, zinc, and antioxidants are critical to set up good mucosal tissue. Keep in mind, you have mucosal tissue in your mouth, in your gastrointestinal tract, in your nasal passage, but also in the vagina. And when you don't have these key nutrients, a good, unhealthy, or if your mucosal lining doesn't stay healthy, then your good bacteria can't set up and stay there. And so supporting these with these good nutrients is very important. One of the key things that can destroy your gut microbiome, but more importantly, your vaginal microbiome, is stress. Stress is so bad on our natural biomes because of its effect on how it affects things like blood sugar. It's catabolic, and it just really has a destructive mechanism. But more importantly, for the vaginal microbiome, cortisol impacts glycogen storage. And we talked about glycogen is the food source for your lactobacillus. So under high stress, high cortisol, we don't have as much glycogen there in the vaginal area. And then all of a sudden, your microbiome stability is going to begin to decrease because it doesn't have its food source. So you may not think that stress can actually affect that, but it can. Also, we want to be careful about the type of foods that we eat. We want to try to eat organic things that aren't covered with a bunch of pesticides. Those aren't covered with a lot of antibiotics, because those also can wipe out our microbiomes, and especially our vaginal microbiome. And the last thing is, what can you do to help support a good, healthy vaginal microbiome? And that's actually work on pelvic floor therapy. That's become very popular with a lot of our women who end up having issues with pelvic floor issues, where we end up having the muscular vascular structure begin to fall and have issues as we get older. And pelvic floor therapy can actually strengthen not only the pelvic floor muscles, but improve blood flow. And with better blood flow, we have a more healthier vaginal microbiome. So as you wrap up, I want to bring in a couple things that I don't want to forget. For a woman, it is so important to have a good, healthy vaginal microbiome. It is actually your defense mechanism to protect your fertility organs like your ovaries and your uterus and all of those healthy, important things as a female for you away from the outside world. And it's that microbiome that's that defense mechanism that sets you up for success. So for instance, if your microbiome is not healthy, it's going to increase your risk of UTIs, sexually transmitted diseases, and other complications even during pregnancy. So keep that vaginal microbiome healthy so that you can have good health in your future. Next, remember, good estrogen equals good vaginal microbiome. Bad estrogen or low estrogen, your vaginal microbiome is going to suffer. So estrogen is so important to keep a good, healthy vaginal microbiome, because you can put back these good bacteria all you want, but without estrogen there, they're not going to thrive, they're not going to be maintained, and you're going to struggle with keeping a good, healthy vaginal microbiome. And remember, when it comes to therapy, you just don't have to take the probiotic by mouth. It can be inserted vaginally. And in terms of chronic UTIs, don't be scared to pair that with things like D-mannose or things like cranberry, PACs, the proanthocyanidins, if you want to break that cycle of urinary tract infections, because I've seen this work for so many patients to be successful. So if you're struggling with chronic UTIs or BV infections or yeast infections, you've got adequate hormones, your microbiome may be the one thing that you're missing that's setting you up for success. Even for things like infertility issues, things like dryness, painful intercourse, it could be your microbiome's out of balance. And if that's the case, replacing and putting back this good lactobacillus species in the right amount with the right species can set you up for success. I hope you found this podcast useful. And if you have, be sure to give it a like. If you know somebody that struggles with recurrent vaginal issues, make sure you share this with your friends and family, because I see this so much. Yes, this is a topic sometimes we won't want to discuss, but it's there, it's factual, it's truthful, it's something that we deal with every day. And good vaginal health is so important. So it's not that we have to take it out of conversation. We need to bring it to the forefront and bring it so that everybody is comfortable to talk about these things, but more importantly, learn the science and the truths about keeping a good, healthy vaginal microbiome. So thanks for joining me for this podcast, and always stay hungry for the truth about how the body works. Have a great day.